Hello friends, today we are going to discuss our medical discussion episode number 23. Today we will discuss on smoking. Today we will, today we will know how a smoking impact in our body, how can we treat and prevent. Sir, my first question is to you that what are the common side effects can be seen in a regular smoker?
Okay, so smoking it is the most important bad habit that can be seen in most of the people. So whenever a person smokes, there are certain acute side effects and there are certain chronic side effects. Normally, the most important chemical that is present in the smoke is nicotine. It is the nicotine which is responsible for causing addiction in a person. So when a person smokes, the first time when he smokes, it can cause bronchospasm. This is the acute narrowing of the airway. So when the smoke comes in contact with the airways for the first time, there can be bronchospasm and the person can feel difficulty in breathing. He can have chronic cough, he can have dryness of the mouth and etc. So when a person smokes for the first time, it is the hypersensitive reaction of the airways that can be seen in most of the cases. So it is the nicotine which is present in the smoke that later on goes to the brain continuously and it causes certain side effects. That the most important is it causes addiction, it causes the habituation of smoking. So when the nicotine reaches the brain, it causes release of some feel good hormones, and that hormones causes the person to feel good for some time. So as the person continues smoking, these feel good hormones continues to be released. So whenever a person stops smoking, these hormones stop secretion and the person ultimately lands up in withdrawal symptoms. There can be anxiety, there can be depression, the person can have difficulty concentrating. So these are all the side effects that can be seen because of the chemical which is present in the smoke, that is nicotine, and it causes long lasting habituation, dependency as well as withdrawal symptoms. So when a person smokes, this is the most important side effect, that is dependency, that causes a person to continuously go on smoking. Now there are other most important side effects which can be seen in chronic smoker. It is said that there are more than 7,000 chemicals or carcinogenic substances which are present in smoke. That is the chemicals that can cause cancers in the body. So when the person continuously smoke, because of the continuous contact of the smoke with the airways becomes thick, the airways becomes tightened, the airways becomes less elastic. Normally the airways present in the lung, they are very elastic structures. So when a person continuously smoke, this elasticity reduces and the airways becomes very thick. The elasticity of the alveoli. The alveoli are the small bags where the air exchange or the oxygen exchange occurs in the bodies. These alveoli also becomes thick, and ultimately the person lands up in chronic obstructive pulmonary disease. This is a disease where the lung gets expanded permanently and the person feels difficulty both in inhalation as well as exhalation. There is also mismatch of the oxygen and carbon dioxide transfer that takes place in the alveoli. Because of this, the person, the normal oxygen concentration in the blood, it goes down, and the carbon dioxide level as well as the carboxy hemoglobin in the blood, it increases. As a result of which, the different organs in the body, it gets less oxygen, and because of this less oxygen, all the organs gets damaged. So when a person continuously smoke, it not only affects the alveoli, it also affects the small capillaries. These are the small blood vessels which are present around the alveoli. These blood vessels also gets damaged, and these blood vessels are the main pathways where the oxygen transfer, carbon dioxide transfer occurs in the lung. As a result, the pressure in the main artery, this is called the pulmonary artery, which comes from the heart to the lung, the pressure in the pulmonary artery increases, and this results in pulmonary arterial hypertension. Because of the increased pressure in this artery, the pressure in the right side of the heart also increases, and ultimately the person lands up in right-sided heart failure. This is one of the most important heart failure which is present in the continuous smoker. Also, the different chemicals, most mainly the various chemicals including nicotine, it goes through the blood to the various organs of the body, ultimately damaging the liver, kidney, brain, eyes, as well as the most important organ that is damaged is the blood vessels. Blood vessels, there is a layer inside the blood vessel wall which we call the endothelium. Normally there occur certain fissures or gaps in the endothelium. These are microscopic gaps, and ultimately the blood cholesterol, triglyceride, this gets deposited in these blood vessels, leading to the narrowing of the blood vessels, and ultimately there can be blood clot formation in the blood vessels, which results in heart attack or stroke. There is almost 10 times increasing rate of the heart rate and the stroke in patients who smoke continuously as compared to the patients who doesn't smoke. Moreover, there is increased deposition of triglyceride, bad cholesterol in other parts of the body like liver or in the abdomen. So as a whole, the person there is an increase in weight of the person. The person becomes obese, and all the bad metabolic profile increases. So there can be because of the narrowing of these blood vessels, there can be uncontrollable hypertension at a very early age. Moreover, there can be kidney failure, there can be decreased vision of the eyes, the blood vessels of the brain, it narrows. As a result, the brain gets less blood. There can be micro strokes, or there can be difficulty in concentrating, there can be memory loss and different other problems that occurs in the brain. As I have already said, there are more than 7,000 carcinogenic chemicals in the smoke. So there is an increased risk of cancers in the mouth, throat, lung cancers, and cancers of the other organs of the body. So the smoking is one of the worst habit that can be seen in the person, leading to a number of different side effects, and it hampers a person both personally, socially, physically, as well as economically. So a lot of burden comes in the family in chronic smokers, and lot of the diseases occurs at a very early age like heart attack, stroke and all.
Thank you, sir. Sir, my next question is to you that so how can we treat this habit to prevent, and how can we aware for this smoking habit?
Normally, as I have already said, that nicotine is the most important chemical which leads to habituation, and that's why a person continuously goes on smoking. So nowadays, for the replacement of the smoking, or the replacement of nicotine that is present in the smoke, nicotine chemical is present, can be taken as medications, it can be taken as chewing gums, it can be taken as patches, nasal sprays, inhalers, etc. So nicotine can be taken as a medicine which replaces the habit of the smoking, and this can be tapered down gradually, and ultimately the patient can avoid smoking. Moreover, there are certain trigger factors that causes a person to smoke, like certain persons smoke in parties with friends, with drinks, or a person when he goes to washroom and all. So the person should identify those triggers and should try to avoid those triggers which lead him to smoke. Number 3, he should ask his family members or near and dear ones to continuously motivate him to not to smoke. So they can be his parents, his girlfriend, boyfriend, etc. So he should be continuously motivated by the near and dear ones to not to smoke. The number 4th step is that he should try to concentrate in other hobbies which he like very much, like it can be exercise, it can be reading books, it can be listening to music. So he should concentrate in other habits or hobbies, so that he forgets the urge to smoke. Whenever he gets that urge to smoke, he should concentrate in these hobbies. He should ask the other family members. He should try to consult with other family members and ask them to motivate him not to smoke. Excessive exercise during the urge to smoke also helps to avoid smoke. He should go for excessive exercises, like he should go for push-ups, he should run, he should walk briskly, he should go for swimming, and etc. This will also help him to avoid smoking. With addition to that, relaxation exercises like yoga, meditation, other relaxing exercises, cognitive behavioral therapies also helps him to avoid smoking.
Thank you, sir. We have learned today so many new things, that how it affect and how can we treat and how we can be prevent. Lastly, what you will ask to the audience regarding this habit?
So I just want to say that smoking is one of the worst habit that is seen in some people, because it has all the side effects. No benefits can be seen from smoking. So everyone should try to avoid smoking, to avoid all the side effects like heart attacks, stroke, hypertension, obesity, metabolic disorders. The people should try to avoid smoking. There are a lot of methods, lot of treatments we have already discussed which help him to avoid smoking. So I hope that people are greatly benefited from this video. People who has the habit of smoking can see our video. They can share with their friends, all other friends who has the habit of such smoking. Hope you will all like, share, as well as subscribe our channel for more such informational videos. Thank you.